the healthcare system, it's frustrating the way it's built. As you know, to your point, it was built on an authoritarian doctor system where the doctor tells you what to do and you say, yes, sir. And then insurance got involved and reinforced that. And you're just told, okay, take this medication. Okay, you have this disease and therefore you are this disease. And things aren't looked at globally, holistically anymore. You're looked at symptomatically and a drug to treat that symptom, which is super frustrating. We need to have a very different approach. And you are seeing naturopathic doctors come to the forefront. You're seeing functional medicine for those that are probably more affluent getting to use that. But there's still a lot of people that I feel like are preyed upon to take drugs for the rest of their lives. I mean, I don't know if you've ever seen the Chris Rock, like one of his comedy shows where he talked about what's the last thing we cured? Polio? You know, and he's talking about it's no different than the drug dealer on your corner. It's all about the comeback, right? Like he's giving away his, cocaine or crack or, whatever. So you keep coming back. And it's the same with all these medications. The great cholesterol farce, right? How many people are on statins? And they actually make people more sick and reduce your mortality, not increase it.
Exactly.
And it's horrendous what we're doing. All of our cells are cholesterol based. Our brain is largely cholesterol based. Our hormones, cholesterol based. And what we're doing with these statins quite often is depleting CoQ10 and creating insufficient cellular energy scenarios that actually sets you up for pretty much all disease and aging. And the fact that this is going on is incredibly frustrating, and no one seems to be addressing it. And the way we actually look at cholesterol is wrong as well, because total cholesterol, HDL, LDL are all calculated, and we're not looking at specific subfractions of cholesterol that we need to look at. Like, for example, when you're on keto, your LDL might go up. Is that a bad thing? Not necessarily. Actually, the large, fluffy LDL subfraction is correlated with better health. There's only one subfraction that's correlated with negative health in terms of cardiovascular risk, and that's the small, dense LDL, the very low density lipoprotein. And you can look at certain markers, like you can look at that with what's called a VAP test or an NMR test, or you can get a lab that looks at ApoA to ApoB ratio. But doctors are not looking at any of these. They're just saying, yep, you got high cholesterol, so let's put you on the statin. Higher cholesterol is correlated with longer life. There's no data on what they're doing. And yet they keep dropping. If you actually look at what they've done over the last 20 years, they keep dropping like where the threshold is for hypercholesterolemia. And guess what that means? More people on these drugs. Guess what that means? More money to big pharma. And it's very frustrating how many people are on these drugs and how it's literally killing people. I'm saying this, I don't want to be executed or sued or whatever, but you know what I'm saying.